Okay, this video is a new clinical question. It has been brought to my attention that many of our colleagues in the high-fat phony school of nutrition might be schizophrenic, providing contradictory messages. They tend to be pretty knowledgeable people, and they know that excess dietary fat causes obesity, hypertension, diabetes, and atherosclerosis. They know these diseases are associated with increased risk of cancer. They know HFD is high-fat diets are associated with more obesity, hypertension, diabetes, immune suppression, and cancer. High-fat diets, they suppress the immune system. They increase the risk of cancer. They make you fat. They cause hypertension and diabetes. They also have a tendency, I've noticed in the high-fat phony community, to say limit oils. And the reason they'll say limit oils is whenever you come down hard on stuff and say no oils, like Dr. Esselstyn says or Dr. McDougall says, you tend to be excluded from a lot of the popular sites, from the bro science channels and things like that. Okay? Many in the high-fat phony nutrition school tend to say things to patients like, oh, well, I daily like to eat nuts. They'll even tell you that nuts are a health food. Nuts are 70 to 90% fat. Don't ever forget that. Oils are 100% fat. They will even tell you that daily it's a good idea to eat walnuts, Brazil nuts, flax, chia, hemp, omega-3. And so here's the question. How is a patient going to minimize the percent of calories from fat if they're eating all that fat? All of this stuff is super fat, super fat. And a lot of them even say olive oil is good. Omega-3s are 100% fat. Olive oil is 100% fat. Canola oil is 100% fat. Okay? I would avoid these things. I wouldn't touch them with a 10-foot ball. Okay. Look at what Dr. Esselstyn says. No nuts, no oils, none, like an Old Testament 10 Commandments. Avoid that crap. Okay, Dr. McDougall says, the fat you eat is the fat you wear. To lose weight, you must reduce fat intake. People can eat only potatoes, just one food, only eat one thing, potatoes. It's the best food in the world, the most complete food. Potatoes have only 1% of calories from fat. So Dr. McDougall, the greatest doctor who ever lived, is telling people you will do just fine if you get only 1% of your calories from fat. And he showed studies where people eat only potatoes for a year and done real well. He says the only thing you'll need to take is B12. That's the only thing potatoes are missing. Because the modern potatoes, the old potatoes would have been fine with a little bit of dirt on them. Okay, because it comes from the bacteria in the soil. Okay, well anyways, McDougall says you can do just fine on 1% of calories from fat. David Blankenhorn, the great atherosclerosis researcher, did studies showing that all dietary fat causes atherosclerosis. All of them, including omega-3s, they all cause atherosclerosis. And it's pretty well known. You want to prevent atherosclerosis, you minimize dietary fat. Nathan Pritikin did an extensive study of lipids. You can read Nathan Pritikin's book for free at the drmcdougall.com website, where his legacy book is there for free. Extensive. He actually described the condition like he called it lipotoxemia, that he basically felt dietary fat was the most toxic thing in the diet. Dr. McDougall also said that the biggest toxin in the Western diet is people eat too much fat. And he said the most important thing to do is, minimize that fat for optimal health. William Roberts said, he's the great atherosclerosis researcher, cardiac pathologist who did all these autopsies. The most important thing for preventing atherosclerosis is to lower one's blood cholesterol. Well, people forget that omega-3s increase your LDL cholesterol, your total cholesterol. You don't want that. I can also tell you, I should have included his name on here, Gregory Sloop. Gregory Sloop, MD, is the greatest atherosclerosis researcher in the world. Gregory Sloop says, as soon as you raise your LDL cholesterol, it's a bridging molecule. It has a positive charge of adequate size that it sticks the red blood cells together. It overcomes their zeta potential, the negative charge on the outer surface of red blood cells, sticks them together, making the blood thick. So it's going to cause the heart to have to pump thick blood, like pumping a milkshake instead of pumping normal blood, which is like water. When you pump thick blood, you got to get that blood to the top of the brain. That's why you have a blood pressure, to pump against gravity to the top of the brain. He says when you're pumping thick blood like a milkshake because of the high-fat meal, then you need increased blood pressure, so you get hypertension. Hypertension then causes atherosclerosis by damaging the arterial walls. So basically, you're screwed with a high-fat diet. There's no way around it. Okay, then you trash your ascending thoracic aorta, and you lose your Windkessel effect. You lose the elastic fibers there. You can't grow them back after maturity, after 20 years of age. Okay, if you look at the lipid experts, the people who really study the omega-3 supplements, they'll tell you people are overdosing on DHA. They don't need that much DHA. Once you give DHA, you can't go backwards to these shorter length omega-3s. You're much better off just eating low-fat plant foods where you get the ALA, the shortest of the, the C18, 18 carbon omega-3 fat, and the body can make that into any of the other omega-3s whenever it needs to, and you get more than enough from low-fat plant foods. Okay, Walter Kempner, probably the second greatest doctor who ever lived after Dr. McDougall, and he got the best weight loss results, the best health results to prevent atherosclerosis, hypertension, reversing EKGs from coronary artery disease, reversing congestive heart failure, reversing hypertensive retinopathy, reversing severe hypertension, patient previously with systolics in the 200s. And what was the diet he fed his patient? Only 3% of calories from fat. Okay, the high-fat phony diets, I haven't calculated the exact percentage of fats, but from what I've estimated, somebody eating walnuts, Brazil nuts, flax, chia, hemp, omega-3s, and possibly olive oil every day, maybe even canola oil, they're going to have a pretty high fat. Again, I haven't calculated, but you can just guesstimate it's going to probably be about 30%. That's a lot of fat. Okay, so anyways, to me it seems kind of schizophrenic telling patients they need to be skinny and avoid obesity, hypertension, diabetes, atherosclerosis, and then you're telling them to eat all this fat. That's a mixed message. It's contradictory things. That seems a little schizophrenic.